Good morning, everybody. This is Simon Shaw from the team at Sustain. I coordinate the Food Power programme, and I'm here with my colleague Layla, who coordinates our London Food Poverty campaign. Today's webinar is run in association with the National Association of Care Catering as well, as part of Meals on Wheels Week 2018. Just before we get started, it would be great if we could just do a quick sound test just to check that people joining at least via online can hear me. So on the left-hand side, you should see an option that says attendee chat towards the top. If you could just click on that and say your name and just where you're from, it's a helpful way to check the sound, but also get a sense of where everybody is from. Great. Hi, Mandy. Hi, Mark. Hello, Anna from Carlisle. Chantal from Croydon in London. Natasha from Fairshare. Catherine from Bristol. Oh, it's going too fast now. Angela from University of Hertfordshire. Nicola from Manchester. Sam from Cambridge. Eloise from Hertfordshire Independent Living Service. Elaine from West Yorkshire. Nick from the NACC. Mandy Smith from Corderdale. Gavin from Leicestershire. I think I've missed a few. Apologies if I have. Great that that's working for you. So for those of you on the phone, I know that some of you aren't seeing the screen, so we'll try and read out slides, etc., rather than relying on you being able to see the screen. So today, as we're going through, if you can use that attendee chat to type your messages to the presenters. And what we tend to do is either respond immediately if it's just sending you a quick bit of information via the chat function, or we group questions for a discussion towards the end of the webinar. It's great if people can use the attendee chat rather than the other option where there's a question mark to ask us questions as presenters. That means they're just private questions, which not everyone will be able to see. We're recording today's webinar, so just to be aware that that's happening, and it will be available to others after today. We'll sort of upload it by the end of today and share that link around. Just on questions again, obviously some of the questions you might have might be quite specific to the delivery models, and there are sort of some commercial sensitivities around some of the information that you might want to know, so it might be better for some of those conversations to happen offline rather than in this sort of public forum. But presenters will have just been advised to just answer what they want to answer on the webinar. So as I indicated earlier, today is a bit of a collaboration between us at Food Power, the London Food Poverty campaign, the National Association of Care Catering, and we were scheduled today to have two presentations from Lily at the London Independent Living Service and Nicola from the West Sussex County Council. Lily is online with us today, and we'll talk about what's been happening in Camden and Haringey. And Nikki, unfortunately, despite multiple efforts and a lot of effort on Nikki and her colleagues' part, we've got a connectivity issue today, so Nikki is listening in, but unfortunately is unable to give her presentation. We've got her slide, and if people have questions specifically for Nikki, then we can obviously pass those on via email. And we're also just thinking if there's a way of perhaps Nikki recording her presentation after today and us sort of merging that with the webinar if the technology allows. So I'm just going to give a bit of context. Nationally, Layla from our London Food Poverty campaign is going to talk a bit about the London context and the other case studies that we've produced in partnership with the NACC, and then Lily will talk about her experiences in Camden and Haringey. We'll look at Nikki's slide, and then we'll have a Q&A session. So today's webinar is focusing on Meals on Wheels, but I didn't want people to think that Meals on Wheels is the only sort of issue we're interested in our work. These are just three examples of some of the context and evidence around older people's access to food. We don't often talk about food poverty in relation to older people specifically, but we are still talking, I think, generally about the same issue of older people's ability to access and afford a healthy diet. Obviously, what a healthy diet means for an older person can be quite different to what might be recommended for a child or a working age adult. So we're obviously conscious of that as well. So here we've got the APPG on Hunger's report that was published at the beginning of the year about hidden hunger and malnutrition in older people. It really highlighted and brought together evidence around the barriers to older people's access to food, so linked to reduced mobility, disability, illness, lack of social care and other services, reduced or no access to transport, difficulty shopping in terms of actually once someone is in the shop, let alone getting there perhaps, and also really important issues around bereavement and isolation and how that impacts on people's practical ability to get food, but also some of the psychological barriers around preparing a good meal in the home. So that report made lots of recommendations, including recommendations around making shopping easier for older people, thinking about how lunch provision, shared meals could be provided in lots of different contexts, and thinking about community transport and how that could be made viable. Then the second report there was a bit of work that the Soil Association carried out as they developed what's now called their Better Care project. And that again identified some opportunities around supporting older people's access to good meals in care, community and hospital settings, and again really focused on how the value of more than a meal and how meals and food provision is as much about tackling social isolation in some circumstances. And then the third YouTube screen grab there is from the Food in Later Life research project at the University of Hertfordshire that I think is a really interesting testimony really to some older people's experiences of going shopping in local shops, and really highlights some of the practical differences that can be made, but also the value of actually the human interaction in shops as well. So again, really tying into that meals or more than meals, agenda. And as those were only 3 reports from a really wide evidence base, this slide is just highlighting some of the examples of interventions around the country. So some well known about and have been running for many years, the RVS's lunch clubs. We've got one of the Hills Meals on Wheels service in Hertfordshire that we'll talk about a little bit more in a moment. We've got the Food to You and Food Train and Slow Shopping initiatives which support older people to shop in different ways, and the red spoon with the on there is the Meal Makers logo. That's a scheme where people make extra food and share that with an older neighbour. And then in the middle there we've got the Food in Later Life game. So all the other interventions here are sort of practical interventions, but the Food in Later Life game is an example of how a sort of creative way of having these conversations with professionals and others about supporting older people to have a healthy diet in later life, and that game is for sale. Then just in terms of some of the key national statistics which have recently been updated by the NACC towards the bottom there. Evidence from BAPEN indicates that malnutrition accounts for nearly 20% of health and social care spending in England. 1.9 million bed days were lost to the NHS in the 4 years up to June 2014. That's equivalent to 482,000 beds per year. That was an Age UK figure from 2015. It costs £400 a day to keep someone in hospital. That's Department of Health stat from 2015. Yet against that cost is the very modest cost of the latest figure being that a 2-course lunch through a Meals on Wheels service costs just £3.60, and that was APSI research for the NACC published just this week. And as part of that research also, APSI found that 42% of councils support a Meals on Wheels service in the UK. This is down from 66% in 2014. But what's quite interesting about the prevalence of council support for Meals on Wheels services is that that ranges between 20% to 80% across the different English regions and devolved nations. So in some areas, you've got 20% of councils supporting Meals on Wheels service. In others, Northern Ireland, it's 80%. So while the overall picture is a negative downturn, actually it's really interesting that in some areas Meals on Wheels services are still very well supported, and there is ongoing buy-in for that support. So now I'll hand over to Layla to discuss some London stats. We know it's not all about London, but given that this is a joint webinar with the London Food Poverty Campaign here, we thought it was just interesting to focus on some London findings, again, some of which have been published this week.
Just to give a bit of background as to where these stats come from. So we produce a report called Beyond the Food Bank, which looks at what London councils are doing to measure or to avert or ease food poverty. And we look at 10 measures, all of which are within the control and influence of local authorities. And one of the measures that we look at is on Meals on Wheels. So that's basically where these stats come from. And how we collect this data is that we send a survey to all council members, and it contains questions around the 10 measures, basically trying to ascertain how well councils are performing on a range of activities that we've identified can improve performance on each particular measure. So NAT produced a report the other day, I think, which was launched at the beginning of Meals on Wheels week, and they found that only 41% of London boroughs are providing a Meals on Wheels service. But that kind of, their methodology is slightly different from ours, which is why the figures are different. But from our report, we found that 24 boroughs, so as I mentioned, we send the surveys out to all London councils, but this year only 24 boroughs responded to our report. So our analysis is based on the responses from the 24 boroughs. So we found that 6 were providing significant support via Meals on Wheels, 5 were providing moderate support, 7 were providing limited support, and 6 weren't providing any support at all. And just to give a bit of context about what I mean by significant support, moderate support, etc. So in the survey, we asked the councils how they prepare meals. So, for example, do they prepare and distribute meals? Do they buy and distribute meals? Do they tender and provide some level of funding? Or do they only signpost people? In addition to that, we asked what the menu options are, because obviously we're interested in the quality of the food and how easy it is for individuals to prepare. So we asked things like, what are the menu options? Is it breakfast? Is it a hot lunch? Is it frozen reheatable? Is it just hot tea, cold tea, etc.? And the final question that we asked, the things that we're looking for, is basically what additional services are provided. So it's, as we mentioned, Meals on Wheels is not just about providing the food. It's also about the additional services that are provided actually help individuals from a social isolation perspective. So we ask things, and from a health perspective as well. So we ask things like, does the Meals on Wheels service ensure that clients are ready to eat the meal? Do they carry out welfare checks? Do they link in with other services? Do they screen for malnutrition? Do they offer professional advice, etc.? So that's basically how we came about the score as to which councils were providing significant support, moderate support, limited support, etc. So we also, in addition to our work around the Beyond the Food Bank report, we've also produced case studies on Meals on Wheels. The first set was produced in 2016, and that only featured 4 case studies. But this year we updated it to include 6 case studies. And the idea with the report is that we're basically looking at these services and outlining how they operate, the additional services or value that they provide beyond the delivery of prepared meals, their local partnerships, and hopes for the future. So as Simon mentioned, Lily from Lilz, which was one of the case studies, is already speaking. But I'll just draw out some of the interesting things that we found from the case studies that we created earlier on this year. So the first was Catered, and they're in Plymouth. And we found that they linked to school. Their Meals on Wheels service linked to school meals provision, generating efficiencies. So some of the things that we've identified are they linked in with residential care in the next phase. Their meals were freshly prepared, and they were looking to expand. They were looking to get more clients, looking to expand to private care homes, lunch clubs, and they were looking at potential opportunities with small local hospitals and extra care housing. Lilz, which is the parent company to Lilz, they have a very impressive scale, 1,400 meals per day. They grew out of consolidating on services across county to develop sustainable social enterprise services. They have multiple additional services, so they have a home from hospital, nutrition, hydration packs and checks, etc. And they're also linking in with others within the community. So they do things like community alarms, advocacy, and dementia fund club. Another of our case study stars, which is in the Midlands. They're quite a small service, but they're doing quite impressive work. So it's very, very modest scale, but they are able to freshly prepare their meals every single day. And then finally, we looked at Dundee Tayside contracts. They were actually one of the original case studies that we looked at in 2016. And three councils of Tayside established not-for-profit organization. Their collaboration between Tayside Cooking and the City Council Delivery. And they also link into other services like the community alarms, handyman, themed menu for lunch clubs, and sheltered housing. And I'm going to pass it on to Simon. So I'm going to continue speaking.
Thanks, Layla. So now I'll hand over to Lily from the London Independent Living Service to talk about what they've been up to there.
Okay, thank you, Simon. I hope everyone can hear me okay. Apology if you can hear me sniffing and coughing. I'm not 100%. But I'll just tell you all a bit about Lilz and about how we operate. So as Layla mentioned, we have a parent company, which is Lilz, Hertfordshire Independent Living Service, that has been going since 2007. They have 1,400 clients a day, and it's a huge, huge operation, 4 sites across Hertfordshire. The idea behind Lilz was to take that model, to pick it up and to try and deliver it in London and see if that model would work. First of all, based in Camden, and we've since expanded to Haringey. So we currently work, as I say, based in Camden. We're partnered with One Housing Group, who some of you may know. They're a sheltered housing scheme, and we operate out of their kitchen. So we order our food in from Appetito, who many of you may know as Wiltshire Farm Foods, is their public-facing brand. And that includes specialist meals such as kosher, halal, West Indian and Caribbean, and texture-modified food for people with dysphagia. So we cook the meals on site in Camden. They're packed into insulated bags that plug into the car, and then we deliver them out to our clients. So we're a not-for-profit, so all of this is done with no extra cost to the client. It's all the surplus is reinvested into the client, which is where those services that Layla was talking about come from, such as a nutrition and wellbeing service, or partnered with A1 opticians to bring eye tests to people in their homes. So really, it's not just about Meals on Wheels, it is about being an independent supporting service. So bringing those kind of other aspects in are really important. So as you can see on my slide, in our last survey, which was sent out to all our clients, 71% of our clients said they visited their GP less as a result of using Meals on Wheels, which we think is pretty amazing. And yeah, for those who feel they need the extra support, we've recently launched our nutrition and wellbeing service, which helps find people in the local community and screen them for malnutrition and offer them free dietetic support for basically as long as they need that. When we go to visit our clients, we do a welfare checkup, which helps us identify those people who might need those screenings. But that also includes making them a cup of tea, cutting up their meal if they'd like that, sitting with them for a minute and chatting and making sure they're okay. That part is particularly important because that's when we get to build up our rapport with the clients. We get to know them very well. And through that, we get to see if they're okay and if there is anything else we need to follow up. So if we can't help ourselves, we will refer, we will signpost, and we will make sure that person is okay. So at the moment, our clients pay $6.99 for their hot lunch, hot dessert, the delivery, and the VAT with a complimentary welfare check. So we hope further down the line that we'll be able to get a no-cost contract with either Camden or Haringey Council, so our VAT is put through the council. But at the moment, we definitely see ourselves as a kind of supplement to health and social care. We see ourselves right on the axis of the two. We battle social isolation as well as malnutrition in the community. We work very closely with Appetito, and our menu is designed fully by nutritionists. So we know that our clients are getting good quality food every day, and we can help kind of battle that 90% of malnutrition that's in the community. I do have a small case study about one of our clients who's called Pete. As he insists on being known, we usually call our clients Mr. Jennings, but he's Pete to everyone. And he's been on our Meals on Wheels service for a few months. Due to his arthritis, he's not able to make meals for himself. Before the service, he told us that he was really worried that he'd end up kind of relying on something and being less independent having Meals on Wheels. But with the nutritional bounds he's making, with the steps he's making, he's now able to perform day-to-day tasks himself and has found himself to be a lot more independent and a lot better nourished. So that's a really great one for us. I think I've sped through that at a rapid pace. I realise I talk a million miles an hour. So if anybody wants to ask me any questions, I'll happily take them at the end. But yeah, I think that's all from me. Simon, I'll come back to you.
Thanks very much, Lily. It's really impressive because for those who aren't aware, those two boroughs in London, I don't think you said it, Lily, services were cut. And this is one example, yes, like with Blaenau Gwent in Wales, where a service was cut and then sometime later someone took the initiative to reintroduce the service because the need was still there. So it's sort of testimony to quite a lot of hard work, as I understand it, to bring back a service to an area where it's being cut. Obviously, that can be much more challenging than passing over a service or a contract to a new provider. So in Nicola's absence, I just wanted to at least read out the points that she wanted to share with you today. She had more information that she would have liked to add, but as I said, we'll try and think of a way of fleshing that out. But there is also the case study that does add some additional information. So in West Sussex County Council area, they deliver about 600 meals a day to a client list of around 700 people. Users pay £5.20 for a 2-course hot meal and £3.25 for an afternoon meal. Any customer who comes off the service is tracked as to why, to reassure the council that they are able to cater for themselves by other means. So I think a really important point there in terms of a service that may be one of the main points of contact with an older person. As well as huge nutritional and hydration benefits, the service also provides safety and well-being checks because, again, yes, it's the service that facilitates daily contact with people who may often be isolated. From their recent customer survey, the 3 most important aspects of the service for their customers were the provision of a hot meal, the personality of the driver, and the time of the meal's delivery. I think all ones that we would also kind of see as important. Importantly, the meals as well meet the NACC's nutritional standards for adults, and West Sussex County Council's plans for the future are to continue to commit to support people at home with their meals, and so therefore the Meals on Wheels service plays a huge part in this strategy. So that's not the justice that I think Nikki could have done to that information, but hopefully that gives you a flavour of what they're doing there. In terms of next steps, it's great that people have been sharing some of the links in the chat, and we do, there is a record that we have behind the scenes of the chat, so we'll make sure we, when I update the website tomorrow, we have those links to the various resources and services that people have been linking to. That's really helpful. So I just wanted to highlight here that the case studies and the NACC's research report are available on the NACC website. The Food in Later Life game, short film and the game are available at that web link. And also I wanted to highlight for anyone listening from Scotland, I don't think anyone on the chat indicated they were from Scotland, but just in case, there's an Eat Well, Age Well, Small Ideas, Big Impact Fund that's about improving older people's access to food in Scotland. And the deadline for applying to that is the 7th of December this year. So quite an interesting pot in Scotland supporting some innovation. So now I'd just like to move to questions. So it can sometimes take a few moments for people to look, to think about and type the questions that they'd like to in the chat. So do start sending those through the attendee chat. We've just had a couple about the slides. So the webinar itself will be recorded and posted on our website. So that's an audio-visual recording of the webinar. I will just check with the presenters afterwards, but I could possibly share a version of the slides as well if it's something you want to use in a different context and maybe it's a bit hard to use the webinar recording. So I imagine that's okay, but I'll just check that afterwards and we'll email that round. I just had a question for Lily myself about, you sort of mentioned the support you've had from the Camden and Haringey councils. I wonder if you have any additional sort of advice for people around engaging with councils and developing that relationship, perhaps in the context of where a service has been cut as well. I don't know how much you can say about that, but it'd be great to hear a bit more.
Sure. So our relationship with the council it's been very supportive in Camden and Haringey. They definitely want us to succeed and they want us to do well. I think for them, as Lilz is a kind of separate company for Hills, we are kind of a startup and we are kind of brand new in that respect. So I think it's taking us a little while to show that we can do what we can say we do. But I think it's a difficult one. It's going to be different in every borough and it's going to be different in every council, how they kind of how interested they are, etc. But we've been quite lucky to have the support we've had, especially in Camden and Haringey. Advice going forward, it's difficult. I'm not sure how applicable our kind of interaction with council would be to anyone else, and even a borough as close to us like Enfield or Barnet, it's just completely different everywhere you go, which is why it's kind of important to get Meals on Wheels out, so it's not a postcode lottery, and so everyone can be able to benefit from that. But yeah, I'm not sure how much I can be helpful in that respect.
Thanks, Lily. We also had a question from Catherine about whether people pay. I think the question is about whether people pay for meals themselves or whether some people have social care funding to pay for their meals in Camden and Haringey.
So our clients pay for their meals themselves. Because we are kind of more of a private social enterprise, unlike Hills, people do have to pay us kind of directly for their food. We're hoping further down the line that we will be able to subsidise costs and we will be able to kind of change that pricing. But right now, as kind of a startup, we have about 200 clients on our books. So we're on a much smaller scale than Hills. So we're not able to kind of make those changes yet. But yeah, at the moment, it's the cost is to the client. We find a lot of our clients do are lucky enough to have their children pay for their meals as well.
That's interesting about the children helping to pay. Sam in Cambridge has asked whether the cost of paying for Meals on Wheels is a barrier to some people taking them up. Lily, I don't know, have you had experience of someone who said they just simply can't afford to access the service? It's a reasonable price.
Sure, yeah. So it's a real difficult one for us because obviously we'd like to be able to provide Meals on Wheels to everyone, and it shouldn't cost really. It's difficult because we don't want it to be a barrier at all. It is for some people a barrier for access. For us, it was a decision of if we charge less, we may not be able to keep going. So in the end, we were like, well, we have to kind of be realistic with our pricing in order to get people meals full stop. We do think that there is a slight barrier to access there, and I think we need to look at it in more kind of detail and have that conversation with the council a little bit more. But for the most part, we found that people are quite willing to pay. They pay for food regardless, and for a hot main meal and hot dessert, we found that people are finding it very reasonable, and they're happy to pay that $6.99 per meal.
Thanks, Lily. That's really interesting. And I'm afraid you're getting all the questions, but you obviously started from zero, and Anna has asked if you have any advice about building a client list. I know that you were partnered with the Housing Association, so I assume that help to some respects, but I don't know if perhaps your knowledge of what Hills have done around that as well might be.
Sure. Yeah, so for building a client list, it's a really difficult thing to do, as a lot of our clients can't get out into the community, so they're difficult to reach. There's been a lot of hurdles in London, we found, more than in Hertfordshire. But for building a client list, I tend to start with council, and we started with One Housing Group, who are the housing association we're partnered with, and kind of built up from there. We've also been in contact with our kind of local NHS, our CCGs, our PPGs, and getting into just local community centres, because it tends to be really word of mouth that we found is the best way for our service, the news to be spread. Older people can't get online, and a lot of them can't even ring. So yeah, we've been just trying to get ourselves known in the community and let people know that we exist and that they're there. But yeah, no, it's a difficult one. I won't lie.
Thanks, Lily. Roger's just made a point in the chat for people on joining by phone that he says that very few local authorities are now subsidising meals, but even at nil cost, not many local authorities are supporting Meals on Wheels. I assume you mean, Roger, sort of referring people to services, endorsing them, even if the council isn't actually putting money into that service. And I think that's why in London we do ask those sort of range of questions to council. So, okay, they may not be putting money into a service, but actually how are they making sure that service exists in their borough? How are they making sure the maximum amount of people know about it, that social care, health services are making older and other people aware of the service? So I think that's why we're always keen to say that obviously funding is important, but that councils have a really important strategic and convening and signposting role that shouldn't be forgotten, despite the sort of different.
Yeah, I'll definitely agree to that. I would say the majority of our referrers are social workers who know about us because of the council. So even though we're not kind of funded by the council, it has been really key to get their support.
Thanks. Sorry, I'm just reading Elaine's question. Interested to gain insights in clients in food poverty, diverse background and social groups have any more barriers to affording the style of service for health and wellbeing nutrition checks. So I think the question from Elaine is about, Lily, whether you've seen any differences in different groups within older people, perhaps benefiting from some of the add-on support you offer. If there's anything you can say about that.
Cool.
I know you're kind of modest, but.
Yeah, so our nutrition wellbeing service, sorry, I don't think I fully explained earlier in the chat, is quite unique in that it's funded entirely by Haringey Council. It's kind of almost separate from our Meals on Wheels service. So we're able to provide that service to anyone in the borough of Haringey, not just limited to our clients. Haringey is a really diverse borough. It has parts of it that are very impoverished. It's hugely diverse in terms of race. So we've seen kind of everyone and anyone in Haringey at the moment who thinks that they might have a problem with malnutrition, or even the other end of the scale, they may feel that they're overweight and they need some support in that respect. We found that it's mostly kind of older women who take us up on the nutrition and wellbeing checks, but we're trying to get ourselves known in circles which maybe wouldn't usually know about us, to capitalise on that service as it is free to the user. So, yeah.
Thanks, Lily. Sam from Cambridge is asking about if anyone knows of models of services who are accessing sort of redistributed surplus food to, I guess, reduce the cost of provision. In a similar way, I guess Food Cycle and others are using redistributed food to provide free shared meals for people in communities. I'm not personally aware of that, but it's not to say it doesn't happen.
It's for us with terms of where we source our food, etc. We'd love to be able to use food that's kind of donated, but to be able to cater for everyone's different dietary requirements, people's needs and their religious beliefs, etc. And because our client base is always in and out of hospital, we have to be able to be super flexible and be able to provide meals kind of at the drop of a hat. that cater to a million different dietary requirements. So that's why Appetito is a really good provider for us, because we can just instantly kind of get the right food to the right people, which would be really difficult to do with kind of donated food. But I do see your point, yeah.
Thanks. Yeah, I think that's an important point about reliability and people's needs. Roger's just flagging, which I think is what you were referring to, Lily, about local authorities being able to reclaim the 20% VAT back on the cost of a meal if people are referred to the council because they need and qualify for sort of some sort of support. Is that what you meant, Lily, as well, in your sort of future plan around helping to reduce the cost?
Yes, so yeah, plans further down the line would be able to kind of put our VAT through the council, because at the moment that costs around £1.50 per meal, which is obviously, it hikes up the price to the client, which we'd like to be able to bring the cost down. But yeah, it's as valuable as the kind of the support and endorsement would be, that kind of no cost contract. But yeah, we're surviving without it, but obviously it would be a great benefit to us further down the line. I'm just seeing Catherine's comment. I'll put my email address in the chat. I'm happy for anyone who's joined us today to email me directly or give me a call.
Sorry, everybody, I went quiet for a while there. I don't think you heard me highlight that Carlisle have got a Meals on Wheels service that is linked into the Fair Share model just recently. They do have access to surplus food. And Chantal in Croydon has highlighted that the local Fair Share collection point does link up with the community lunch club there. So I think everyone can hear me now. Please ask any more final questions, otherwise we'll bring the webinar to a close. As I said, we've got some really useful links there that I think, along with sort of a lot of our work here at Sustain, we don't have the full picture, so it's really helpful for people to come onto these webinars and tell us what's happening in their local areas, and then we can sort of add that to the information we provide. We hope that, unfortunately, the NAC research has shown this ongoing decline in Meals on Wheels provision specifically, but that there are still services and new services as well in some cases, sort of bucking that trend and showing that different models do work, some that also bring in local food preparation, as well as the sort of multiple additional benefits that lots of services that we feature in the case studies are bringing in, whether that's sort of very informal human contact with people or much more specific advocacy and other kinds of services as well. So I think as the questions have ended, last question, I think Angela's asked about if there's something we can do to prevent the decline in Meals on Wheels and the need to collectively organise. I think that is really important, and at Sustain we are trying to think through how we might work together more with others, and there is a real coalition forming around this. And then, as Nick says, the NACC is organising in terms of its membership and regional seminars that take place 3 times a year across 6 regions. I think there's some momentum growing around this. So I think that's something that we will think about. It's part of Food Power's work, part of the London Food Poverty Campaign's work. But I think that Angela's right, there's a need for some sort of really concerted effort around this, because ultimately there are lots of older people who may be going without who shouldn't be. So we'll bring the webinar to a close now. Thank you very much to Lily and to Nikki, who's frustratingly unable to present, but has been listening in and will be available for questions after today. As I said, the webinar will be recorded and up on the website later this afternoon, and I will email you all with that information and the new website information that we've got following today's. That'll be tomorrow, realistically. But anyway, thanks very much for joining.